Okay, we'll go ahead and get started. Good morning, good afternoon, good evening, everyone. Welcome to International Medical Corps' year-end global briefing. I'm Rebecca Milner, International Medical Corps' Chief Advancement Officer. We're delighted that you've joined us today. Many of you on the call have generously supported our work over the years, and we're incredibly grateful for your trust and commitment. We couldn't do it without you. Your support, in fact, makes our work possible. And together, we're able to make a real difference. So thank you very much. We're going to keep today's briefing as efficient as possible. We plan to wrap up in about 45 minutes. Toward the end of our conversation, we'll take questions from the chat. So as we talk, please feel free to type in your questions and we'll do our best to get to them. I'm very happy to welcome three of our colleagues to share more about conditions on the ground in the countries in which we work, update us on our programs as we come to a year end, and talk a little bit about the upcoming challenges in 2023. First, let me introduce Dr. Javed Ali, Senior Director for Emergency Response. Javed spearheaded our ramp up in Ukraine when the war began 9 months ago. And under his leadership, our team has grown from around 30 to more than 350 people in dozens of cities across the country. Our teams are working in active conflict zones in the south, previously occupied territories in the northeast, including freshly liberated areas, as well as with displaced people in host communities in the west. We have provided life-saving and critical assistance to millions under Javed's leadership. And as a medical doctor, Javed has more than a decade of experience working in humanitarian and refugee emergencies across Africa and the Middle East. We're so glad that you could join us, Javed, from Amman, Jordan. We also have David Eastman, a longtime member of our team who previously led our programs serving refugees and displaced families in underreported and under-resourced crises in places like Darfur and Lebanon. He is now Senior Director overseeing International Medical Corps operations in East Africa, Europe, and Asia, where some of the world's largest and most complex humanitarian crises are now playing out. David, we're so glad you've joined us. David is in Kabul today, so we hope that his connection holds out for the next 45 minutes or so. And we're also delighted to welcome Susan Mangicaro. Susan is a registered nurse and a member of our emergency response unit who's often first on the ground after a disaster hits. She's led teams into New York early in the COVID-19 outbreak pandemic and has led our responses following hurricanes in Puerto Rico, the Bahamas, and most recently in Florida after Hurricane Ian. Susan, we're delighted to have you with us from Florida. Welcome to you all, and as always, thankful so much. We thank you so much for the work that you do. Javed, I'm going to start with you. 2022 was quite a year. More than 70 million people are in need of humanitarian assistance around the world, and more than 100 million have been forcibly displaced from their homes worldwide. International Medical Corps is there on the front lines of many of these crises. And of course, top of mind is the conflict in Ukraine, which really reshaped our world and has impacted millions of people. But conditions in many countries across the globe are grim. Why don't you start by sharing with us some of the drivers of these humanitarian crises?
Thanks a lot, Rebecca, for having me, and good morning, good afternoon to everyone. Well, a sad reality, right? These numbers, as they paint a picture of what exactly is happening on the global emergency landscape. Now, I mean, a situation turns into an emergency when the crisis affected population loses their intrinsic defense mechanisms to deal with the level of crisis. And generally, when you look at the emergencies, they're basically grouped into three categories. You have the natural disasters, earthquake, flooding, etc., or man-made disasters, predominantly conflict, or disease outbreaks, as we saw with COVID-19 back in 2020. But irrespective of the typology or the causative event, the principle is the same. Generally, it's to save lives and reduce suffering, and that's what we're trying to do across all these countries that we work in. Now, going back to the numbers that you quoted, about 400 million people in need of humanitarian assistance and more than 100 million people displaced forcibly. I mean, can you believe these, about 10 years ago, these numbers were a fraction of what we see today. In fact, I think towards the end of 2021, the total number of people in need, of humanitarian assistance was about 300 million. So it's rising quite dramatically. And when you look at, the cause behind it, largely there are two main drivers. One is the climate change that's leading to recurrent, unforeseen natural disasters, something we saw in Pakistan this year with, flooding displacing about 33 million people, and conflict. Conflict leads to disruption of systems, loss of life, displacement of population, and of course, it also leads to disease outbreaks. So they're all quite closely interconnected. And then, of course, as a result, the population loses access to critical and essential health services and other allied services, supply chain disruptions, etc., which leads to then these unforeseen, statistics that you see. So yeah, all in all, they're just main two leading drivers for it: the climate change and as well as conflict, as we saw in case of Ukraine and Tigray and so many other countries across the globe.
Right. Well, I mean, let's talk a little bit about Ukraine. International Medical Corps has a long history there, and we were really well positioned to immediately provide life-saving assistance after the conflict broke out. But now, 9 months later, we're reading the headlines about ongoing attacks on infrastructure that are crippling healthcare services, bringing the economy to a halt, and threatening to leave millions without powers during the coldest months of the year. I mean, how are we navigating these kind of conditions? It's very challenging.
I mean, it certainly is very challenging. In fact, when we started our response in Ukraine, the context back then was extremely challenging. This was, end of February, early March. The greater Eastern region was totally cut off. Access was completely hampered, and on top of it, there were regions and oblasts and cities that were either besieged or totally, under Russian control. And there was indiscriminate bombing that was going on of health facilities, critical infrastructure, water and sanitation services, et cetera, et cetera. So it was pretty intense and very, very challenging. Now, for us, we kept the strategy very simple. Our aim was to focus initially on access to life-saving services and enhancing the availability of services. So as such, in the beginning, we just focused on, laying down an infrastructure for supply chain so that all those health facilities that are operating close to the front lines have access to medications. And we started, as you mentioned, 350 staff. We started recruitments. We started, creating these emergency response hubs in different regions of the country. Now, we knew already that the crisis was way bigger than, the capacity of any single organization. So we had close coordination with a lot of on-ground actors. And we had this, hybrid implementation modality where we also partnered with local organizations. We started funding them in areas where we couldn't reach, we couldn't have access to. And at the same time, there were places where there were the local volunteer groups that were responding. So we put in place a workforce development in emergencies project that trained those doctors, nurses, paramedical staff on, critical life-saving skills, etc. So all in all, I mean, it was challenging. What actually guided us was our history of operating not only in Ukraine but in similar context, elsewhere, including Afghanistan, back in the 80s. So we utilized our historical knowledge and as well as our understanding of the country to basically navigate through this crisis. And our team is still working there. I mean, currently we have about 8 different emergency response hubs. So we have almost 25 partners who are working with us, local organizations who know the context really well, and that has been extremely helpful. So yeah, I mean, it's a work in progress, and while we are satisfied with what we have done, there's a lot more that we need to do moving on. Yeah.
Right. Well, I mean, let's talk a little bit about Afghanistan. I mean, Dave, you oversee our efforts there and are in Kabul right now. I mean, Afghanistan is still reeling from the Taliban takeover last year, and we don't often hear a lot about how the Afghan people are faring now. But an estimated 18 million people are in need of humanitarian health services, with over 1 million in critical need. News reports have noted that the health system is teetering on the brink of collapse, and the country remains one of the most dangerous places in the world to give birth. And now, as with Ukraine, they're dealing with an incredibly harsh winter. Talk a little bit about the situation on the ground and how our teams are navigating these challenges.
I would describe it as tense and getting worse.
Mm.
By the way, my mom didn't know that I was in Kabul. And I think she's watching right now. So hi, Mom. And yeah, it's cold. I'm wearing a scarf.
Yes, I see that.
But, you know, International Medical Corps was born in Afghanistan. It was where we started. And because of that, we have such strong community acceptance. And even when there was the changeover in government last year, we maintained our services. In fact, we were the first organization to respond in Kabul when there were displaced people coming into Kabul. We sent, even when our teams were at home, sheltering at home, during all of that drama that you saw that first week, we still sent out mobile teams to respond to that. And we now are fully functional. All of our services are functional in North and East Afghanistan. And that includes 55 mobile and health fixed health facilities. We do WASH, mental health, nutrition services. And what's really exciting is that because we've been here for so long and been building capacity of Afghan trauma and first aid teams, when there was a 5.9 magnitude earthquake last June, the teams that we had trained in North Afghanistan were there within 45 minutes at the epicenter. And within a few days, they had provided life-saving services to more than 2,300 people. And this is despite the operating context that they're in. They also provided shelter and water and soap and other items so that people could be resilient in the midst of all that. But yeah, it's cold now. And it's also very, very difficult for our staff, particularly the women who work with us. They have to be accompanied by men when they leave the home. And for women who work in health facilities who are doing services in the communities, and they have to be accompanied by men, where does the man sit all day? Does he sit at the back of the clinic? We have to rent extra vehicles for the men to ride along in. It means more costs. It means more thinking. And what about the wife and the family of the man who has to go along with the woman who's providing those services? So it's just made everything more complicated and more difficult. And even for the young men staff, young people who grew up listening to music in their cars, wearing jeans, wearing cool t-shirts, they can't do that anymore. They get stopped on the street. They get stopped if they're playing music in their car. They get searched. Every time they walk to work, it's difficult. So I think the biggest challenge that we have right now is keeping the hope alive for our staff who are really having to transition to a much more restrictive environment. But I have to say, we're still here. I was here in 2001 when the old Taliban were here. I was here in 2015 when there were attacks. And now I'm here in 2022, and we're still here, we're still operating. And that's largely because our Afghan staff is so powerful.
Right. I mean, we have about 1,000 team members on the ground. Is that right?
So this year, despite everything, we grew from a staff of 400 to 1,450.
Oh,
we may grow even more. So it's a huge program now.
Right. But it's a testament, right, to the work that the team has done to get community acceptance, right? And the community is really what sort of defends us from potential undermining of our work, right?
And even when we have challenges with the Taliban authorities, I was talking to a female doctor today. I said, what do you do when they don't understand what we do? She said, I talk. And we gain acceptance when they understand, because everybody has families, everybody has children, everybody understands that everyone needs healthcare. And so at the end of the day, they want us to be there because they want to serve their own families. It doesn't matter who they are.
Right. Well, at the intersection of conflict and climate change is countries in the Horn of Africa. Can you talk a little bit about what's happening in Somalia first, and then maybe touch a little bit on Ethiopia too?
So for anybody who's a Steinbeck fan, I mean, we're heading for a dust bowl. It's been 4 years of no rain. And when in some areas, I literally mean 0 days of rain, where normally they would expect 130 in a rainy season for farming. So after 4 or 5 years, crops are about this high. When I traveled through the areas in Ethiopia, for example, I saw crops that were yellow and about this high when they should have been corn. growing. Animals are starving, they're skin and bones. And these are people in Somalia, for example, who are nomadic. Animals are their lives, animals are their children. And when their animals die, it's a massive impact on their emotional state, and also on their economy. So it's leading to displacement. They're gathering in cities that aren't able to support all of the needs of those people. And so those health services that we're supporting in those areas are so important. It's also really challenging for the lifestyle of those people. We're seeing entire communities moving and emptying out. So the climate change effect is having effects even on cultures, I would say. And the thing that really struck me in our work, and I think Javed can attest to this, a lot of times when we do what we call assessments, when you go to the site where there's an emergency, you say, so what are your needs? What would you like to do? And most of the time they say, well, we'd really like to rebuild that school, or our hospital needs, a new generator, or we'd really like training for trauma care. This is the first time I've ever gone to a place and they looked me right in the eye and said, we need water. We need food and water. And because they needed water for tomorrow. Mm-hmm. It's extremely dire.
Right. But is access a challenge to a lot of these communities?
Well, these are big countries. So if you're going to go even to a place that's safe, you're driving 8 hours over bumpy roads anyway. So my spine is, dust at this point. But in Somalia, yeah, there are areas where it's highly, and in parts of Ethiopia, that are highly insecure and hard to access. And in addition, we have a civil war that's been going on for 2 years in northern Ethiopia, which has compounded where they're also affected by drought and hunger issues. So you can't bring in humanitarian food, cash, medicines to those areas when they're cut off.
Right. Super challenging. But the United States, the wealthiest country in the world, is not immune from climate change. And Sue, maybe you can talk a little bit about, how we've seen both COVID-19 and climate change impact communities across the country. We're here in the United States, we're increasingly confronting repeated disasters of our own, right? The entire Caribbean has experienced multiple disasters. Florida keeps getting hit. What are some of the biggest challenges that you and your teams have been facing in responding to these sort of dramatic, powerful events?
Yeah, thanks, Rebecca, and thanks for having me on. Some of the challenges that we see across the globe, we're seeing right here in the US. So the most recent storm, which really was devastating to Southwest Florida, my home, impacted not only the livelihood, but the healthcare system took really a direct hit. In the area that we were positioned right outside of Fort Myers, which was the direct hit, there were 6 hospitals, of which only 1 was fully operational. So we see some of those same impacts here. There were 7 DMATs, which are kind of the HHS disaster medical assistant teams, their mobile hospitals set up. That's the most ever in the history of storms in Florida. The storm they're estimating is a multi-billion-dollar impact to the state. So, access was compromised, getting to the barrier islands where bridges were out, getting patients that were there and folks that were there. Cell towers and communication was down. Some of the same exact challenges that we see globally, we're seeing here in the US. We have a crisis with nursing staffing in the US. And when a storm hits, those individuals that would be able to help out are now impacted as well. So the delivery of care was impacted greatly. And what we're seeing is a very strained system that in the past with supply chain travel, et cetera, is magnified. And we continue to see what we're witnessing is like repetitive loss. So folks losing homes, jobs, mental health, physical health. It's kind of a crisis within a crisis. And I've always been amazed at the resiliency that I've seen within a crisis. But I'm beginning to see that some of the most frail, that this resiliency is kind of shrinking, and the support that we're able to survive, I think, is invaluable.
Right. I mean, the repetitive disasters that have hit Puerto Rico, I mean, is a great example, right? Hurricanes Irma and Maria, 2017, 2018, the earthquake in 2020, COVID-19, Hurricane Fiona. I mean, it's all of that's happened in the last 5 years. And so the expectation of communities to be resilient and bounce back is difficult, right?
Yeah, it's absolutely waning. We're seeing it, globally. We're seeing it here in the US. I mean, folks are just so burned out and just really traumatized from the events that have occurred in hit after hit after hit, as you mentioned, in Puerto Rico, in Florida, and some of the hardest hit states. It's been really difficult in straining on the population.
Right. I mean, a lot of times I'm asked questions about, well, why is International Medical Corps working in the United States? I mean, what do you have to offer? And it's an interesting question, but talk a little bit about how we use our international experience to implement programs and responses in the United States.
Absolutely. We bring our core competencies that the agency was founded on really to support here in the US. When you think about the expertise that we have globally in supply chain management and logistics and coordination, in providing that expert kind of medical care with doctors and nurses that have expertise and have been vetted and are trained in emergency response, and we provide them additional training that allows us to support disasters in crisis here in the US, again, for the most vulnerable population. I used to think years ago, well, we don't really need support in the US. We've kind of got this. And what really turned for me personally is when we had to ensure capacity at the community level when COVID hit. We were first on the ground, and I led the team in New York City there. And we worked side by side with hospitals, with healthcare facilities. The system was in crisis. And I realized then that we're just as vulnerable as any other region of the world, and that the expertise that we could bring forth with respect to all of those competencies, we did that by helping them manage triage, by helping them manage patient flow, providing the emergency field units, providing equipment, providing staff when no one else was willing to go into New York City. That was ground zero at the time. And it was frightening for everyone at the onset of the pandemic. So I think thanks to the expertise that we bring in going first into regions that are very high risk and vulnerable, such as my colleagues here have been talking about, it gives us the opportunity to bring that same expertise and those resources into the US, where kind of the folks that need it the most are able to receive that care.
Right. I just want to encourage our listeners, if you do have a question, please do type them into the chat. I mean, as we've talked about all of these challenging environments and situations, Javed, David, Susan, I mean, can we talk a little bit about our staff and just healthcare staff in general, and how can we help them care for themselves and overcome some of these challenges and obstacles? I mean, Javed, I mean, such a hot environment in the Ukraine. Maybe talk a little bit about some of the ways that we support our staff and healthcare staff more broadly.
Right. Well, we in emergencies generally we have a staff well-being policy. So basically, we always have somebody responsible for staff well-being, both from an administrative perspective and as well as from a psychosocial perspective. So to start with, before we send anyone to the field, we brief them thoroughly. They undergo an orientation, where they're briefed about the context, the difficulties, the challenges, so that they can decide for themselves. And then when they arrive in the field, they also go through an onboarding process. And then there are peer support groups in these emergency, contexts. And on top of it, we have access to an online system where our staff, if they feel pressurized, challenged, or emotionally vulnerable, they can reach out and ask for help. So it's a very dynamic program. We have regular check-ins with our staff, and we have in each of our locations for instance, in Ukraine, we have a staff well-being person whose main job is to ensure that people are actually taking care of themselves, and there is some kind of a work-life balance there while working in these emergency contexts. So those are a couple of mechanisms that we have. But yeah, people who generally decide to deploy to the field, they are very often people who have experienced working in similar emergencies. Like in Ukraine, we were quite lucky because most of the staff who came out, they were people who had worked with us in previous countries, and they actually wanted to come and offer help. So yeah, I mean, they have their own personal experience as well. They have their own coping mechanisms, and on top of it, the agency offers certain ways to ensure staff well-being.
Right. But Dave, in Somalia and Afghanistan in particular, I mean, we have team members that have been with us for decades, right? I mean, and it's a difficult environment to navigate in the short term, but also in the long term. I mean, how do we support our national team members and ensure their safety and security?
Well, certainly we monitor the situations. We learn about information if there's what's happening that might involve violence. But I think there's another aspect to it, which is that people who do this work, their motivation is that they want to help people. Mm-hmm. And by being an organization that tries to remove barriers, administrative barriers, hurdles, and giving them the support and the resources that they need so they can do that as effectively and quickly as possible, that makes them feel good. That's their reward at the end of the day. And so that's why I enjoy the work, because that's what my job is to enable those people to succeed in helping other people. I think that when the times are tough, when it's cold, when you're sick, when you don't have any electricity, but you really are enjoying your work because of what you do, that can also give you a sense of well-being. Another thing that we offer is a chance to grow professionally. So national staff who are high performers, who are stars, they'll grow within their country, but we also give them the opportunity to move on to other countries and develop a career. And as Javed was saying, show up in Ukraine 10 years down the road in their career. So it's an organization that's large enough and professional enough and demanding enough that people can feel that when they are successful, they have somewhere to go, that they can have a career that will support them.
Yeah. Well, and then Sue, I mean, this is a little bit outside of International Medical Corps, but because of COVID-19 and the multiple emergencies and disasters, I mean, the healthcare professionals throughout the United States are experiencing a lot of fatigue and challenges. I mean, how do we support healthcare professionals, health and well-being, both mental health and physical health?
Yeah, and I think it's quite similar to what both Javed and David mentioned. We do always have an individual on the ground that focus with staff health and well-being. We have check-ins after we've been deployed for a week, because it's usually at the onset of a crisis, very intense for the first week or so. So we do a well-being check. In addition, we have regular debriefing sessions morning and afternoon so that our folks can basically kind of talk about their day, share any experiences, and elevate anything that needs to be addressed. It's never perfect, but I think, as David said, we have people that are there because they want to do this work. They want to help others. And that's the key, is really without those individuals, without those volunteer doctors and nurses, we wouldn't be able to do what we do. So it's really critical to the success of the agency.
Right. And so as we wrap up 2022, I mean, and you're looking toward next year, I mean, Javed, what are the either the countries or the issues that you're really keeping an eye on and think we'll be dealing with in 2023? Oh, are you on mute?
Yeah, well, you started the discussion with some of those numbers, right? I mean, we have quite a large population of the world that's in need of humanitarian crisis. So I mean, thematically looking at some of these events over the horizon, I mean, today there are more than 800 million people who are living in food insecure zones, and those countries are, spread over different continents. So out of that, about 50 million people are basically at the verge of famine. And these are countries in the Sahel region, in the Horn of Africa, in Syria, in Afghanistan, in Haiti. And similarly, there are more active conflict hotspots today that, since 1945, since the Second World War came to an end. And we still have, we hope that the situation would not escalate any further in Ukraine. We have a situation that's currently evolving in the Horn of Africa with regards to conflict, and then of course the whole Sahel region is totally disrupted in terms of the different armed groups that are operating there. Climate change itself, climate-induced natural disasters are going to be more and more common, as we have seen in 2021 and 2022. And then, of course, disease outbreaks with more than 100 million people displaced. You would always be vulnerable to disease outbreaks. And on top of it, we are living in the era of pandemics. So I would not be surprised if we see an emerging infectious disease, in 2023. So talking about the countries, of course, we have the political instability that threatens peace efforts in Darfur, in Sudan. Similarly, in Syria, we see economic crisis, we see rapid inflation, food insecurity on top of it, recent outbreak of cholera. Somalia, it's the same, 3 million people currently displaced with ongoing, quite complicated, complex conflict. And on top of it, as David was mentioning, the drought situation, DRC, South Sudan. There are plenty of countries where we'll see these type of emergencies coming up. While we hope for the best, we are actually preparing for the worst in the hindsight. So yeah, those are some of the things that come to mind. I'll pass it over to Dave and Sue to add to it.
Dave, what do you think?
I think in Afghanistan, unfortunately, I think restrictions are going to continue to tighten, and quietly. At first, women were not allowed to work in the ministries. Then women were not allowed to walk in the street without a man. Then women were not allowed to go to the fun park. Now women are being flogged in public. So these restrictions, that's just speaking about the horrible things that are happening to women who previously were professional doctors or even ministers in the government. And I think that we will have to continue to find ways to adapt and maintain our services and protect the safety of those women who want to keep working. And there are so many that work with us. And the nice thing is that they say, walking to work, being home, we can't do anything. But when we're at the office, it's great. They love being at work. They love doing the work they do. And so continuing our presence has the double benefit of giving those people a positive place to spend, 8-9 hours of their day. I think as Javed said, in the Horn of Africa, unfortunately, the message hasn't gotten out that it's going to get worse. It's going to be, this last harvest failed. So the next year, it could be a real famine. As a kid, I grew up with the Live Aid concert, and I hope we don't get there, but I think there could be some areas in Somalia, maybe even Ethiopia, that we see that again, unfortunately. And I think that, as Javed said, we responded in Pakistan, and we're preparing for the next phase. But while we're doing that, we're also looking at how we can build on what we've done, working with the government and communities, particularly in areas where they don't have a lot of strength, such as mental health care. As we did in Lebanon years ago, building the government's capacity to have a mental health department or integrate that into their services. Why not, unfortunately, take this opportunity to start building on that where there's been a disaster, and then start doing that capacity building. And that's what we do best. Is unfortunately, sometimes disasters give us the opportunity to really engage with communities and engage with governments to start making a positive change for the better.
Right. Well, yeah, right. Mental health has been a priority and will remain one for 2023, certainly. Sue, what do you think are some of the areas that we should be watching out for in 2023?
Yeah, I think, when I look out in my crystal ball, I think the continued strain on our healthcare system, as well as kind of some of the things that we're just mentioning, which is areas of conflict, pandemics. It's the perfect storm. So the strain that it's putting on staff and the supply chain, is really increasing needs, and we're seeing outpaced demand versus supply, and I think that those are my concerns. But with that, I also think that the need for support from agencies such as International Medical Corps and the expertise that we bring to the table will be even more critical next year and the year after go forward than it's ever been before.
Right. Yeah. Well, I mean, as we started, right, conditions are grim in a lot of countries, but, our team members are motivated to keep moving forward and helping. I mean, maybe we could talk, Javed, David, and Susan, a little bit about sort of what motivates you and your teams, and how you keep persevering in the face of these considerable obstacles. Javed, you want to start?
Well, so my dad was a humanitarian worker. So I watched him going to the field while growing up, and I became a doctor to work in this field. I'm conscious of my capacity and my capability. So, from my perspective, I love what I do. Looking at all that is happening in the world, if there's a little bit that I can bring on the table to alleviate suffering of even a few individuals, that's good enough for me. In terms of coping mechanisms, I mean, like I mentioned earlier, we all have our ups and downs. So there are certain personal coping strategies that I have, and on top of it, we have this peer support network out there that I very often tap into. But yeah, what keeps me going is the fact that there's still a lot to be done. And I work for an organization that came into existence because of because it directly witnessed what was happening in a conflict zone. And I come from a country which was in grip of conflict and sectarian violence while I was a school-going child. So all that motivates me to do more, to get out of my comfort zone and offer support to the best of my capacity.
Thanks, Javed. What do you think, David?
I mean, they say that what we're doing is helping other people, but I mean, this job is completely selfish because it feels good to do the work. And I like to work with International Medical Corps because it's an organization that enables me to help other people in an effective way. So it's given me the chance to do what I would want to do anyway. I think that, we work in extremely resource constrained environments. So finding the best ways to use the money that we have with the little that we have to have as much impact. That's also kind of part of the challenge, part of the fun, part of the camaraderie. And I think the last thing that really drives me is that if you imagine having to flee your home and go run into the desert and then make a shelter out of garbage bags and find water, and you have 3 kids and your husband just got killed. I mean, these people are the Indiana Jones of humanity. I mean, they are survivors, and to work with these people and they can still smile and joke. I know there's a lot of pain there, but when you work with these people and they become leaders and they also want to help their fellow displaced people, their fellow refugees, it's really an honor to work with people like that. So I think that is probably the most fun part of the work is meeting these people that, frankly, you would. They're few and far between, but it's just wonderful to meet those people and engage with them.
Sue?
2 things. It's the mission and the people. I mean, going third, you have the advantage of kind of repeating what others have said, but it's true. It's the people, both the International Medical Corps staff, leadership, and equally important our volunteers, so that we can serve the recipients. It's really a reflection of the values of the agency. People that are driven, people that are motivated, committing, willing to go the extra mile. It's really what makes the hard work all worth it. it helps us to get up every day and do what we do, and it's an honor and a privilege.
Right. Well, and I just would echo all of that and just say to the people who are listening in, you are part of this. You are very much part of this sort of global effort to alleviate suffering and save lives. And so we just thank you and appreciate all of your tremendous support, your commitment, and your longtime belief in International Medical Corps. So we'll wrap it up here. Wanted to say thank you to Javed, David, and Sue for joining us today. Thank you for your insights. It's been a tremendous discussion. Really appreciate it. And we look forward to seeing everyone in 2023, and we'll have another briefing to kind of kick off the year. So thank you, everyone, and be well. Thank you.